Welcome to Good Shepherd Rehabilitation Hospital. We want your stay to be comfortable. Loose-fitting clothing and shoes with rubber soles are best. You will be assisted with bathing or showering daily. You will notice your own phone and television remote at your bedside. Long-distance calls require a calling card or collect call. Earphones are available upon request. We encourage you to keep your personal cell phone at home. Nutrition plays a vital role in your rehabilitation. The Food and Nutrition Services Department provides balanced, flavorful, and nourishing meals. Menus are completed in advance and available for you to order. If you're unable to complete the order, staff or a family member may assist you. Meal vouchers are available for family from the unit secretary. Dietitians also are available to provide nutrition education to patients and families during their stay. Family involvement is important. Caregivers are encouraged to be present during therapy, and your rehabilitation team may schedule specific family training. This helps to ensure your safety and comfort upon discharge. A daily therapy schedule will be provided and is available for you and your family the night before. Schedules are subject to change. Visiting hours are 10 a.m. to 8 p.m. For group visits of more than 3 people, please speak with the nursing supervisor prior to the visit. During your stay, your care will be provided by a comprehensive team. Care management will speak with you regularly and serve as a liaison for you, your family, the clinical team and insurance providers, and assist with goal setting, discharge planning, and more. Care management also helps with ordering medical supplies and equipment for home. The physical medicine and rehabilitation physician or physiatrist will lead your care, including coordination of all specialties and therapies to optimize your medical stability and rehabilitation. The doctor also will manage your medications, blood work, and diagnostic imaging studies. All outside appointments and communication with other specialists are arranged by the physician. An internal medicine physician may also be involved in your care, depending on the complexity of your medical needs. Nursing care is provided at all times and will help promote independence with activities of daily living. The rehabilitation nurse will also work closely with you and your family to provide education in areas such as medications, morning and evening care, bowel and bladder care, and feeding programs. The Respiratory Therapy Department helps to diagnose and manage heart and lung issues, including breathing difficulties. Neuropsychologists, who specialize in working with individuals who have sustained a brain injury, stroke, or have other medical issues, may be consulted to provide counseling. The neuropsychologist works with you and your rehabilitation team to discuss management of changes in thinking, behavior, and mood. As part of your rehabilitation stay, you'll receive 3 hours of therapy services daily, Monday through Friday, and weekends as needed. Family and caregiver participation in therapy sessions is encouraged. When patients are discharged, they may need continued care or supervision. The team will help guide caregivers through this process. In physical therapy, the goal is to maximize your core and leg strength to help you maintain or improve the motion in your joints, to increase your endurance with activities, and to improve your balance to help you be as independent as possible. A physical therapist will recommend equipment that you may need to function safely at home. Most patients continue therapy services after discharge. Occupational therapy will help improve your independence with activities of daily living and transferring to various surfaces. Occupational therapists complete home evaluations as needed and provide education on durable medical equipment, such as tub seats and dressing devices that can improve the safety and accessibility of your home. Additionally, occupational therapy may help you with return to work, including how to complete jobs more simply and effectively. During your rehabilitation, you also may work with speech therapists to improve speech, language, or cognition. Speech therapy also may recommend a modified diet and provide swallowing therapy to help you safely eat and drink again. Patients who are more medically complex may return home with a feeding tube, and swallowing therapy would continue after discharge. The goal of recreational therapy is to help you get back to enjoying the things you love, using leisure activities to enhance your quality of life. The recreational therapy area is available for patient and family use at all times. Recreational therapy has a variety of adaptive equipment that can be used to modify activities as needed. Prior to discharge, a recreational therapist will provide education on leisure possibilities, community accessibility, and more. Community reintegration outings may be offered to patients and their families to practice functional skills in the community setting. Your rehab team at Good Shepherd is here to help you. Your rehabilitation success is important to us.